Good morning, good afternoon, good evening. Depends on where you are in the world watching this. I know a lot of us are watching this online today. My name is Ali Shivji. I'm one of the principals at Optima Living. I'm joined by the illustrious Dr. Adrian Wagg for a very exciting and interesting topic today. The topic of sex and seniors, debunking the myths, part 2. As part 1 seemed to now be a large internet sensation, we ask all of you to go onto our YouTube channel, check out all the different videos that we have, including part 1 of debunking the myths of sex and seniors, youtube.com/Optima Living. Before we start today, I want to just acknowledge that today we are recording this webinar. At least I'm on my side, at least recording this webinar in Strathcona County, in the province of Alberta and Edmonton, in the Edmonton region, and within the Strathcona County context and within Optima Living. We respectively acknowledge that we are located on Treaty 6 territory, and that for thousands of years, Indigenous people have lived and thrived in this place. We stand upon the land that carries the footsteps of the Cree, the Métis, the Blackfoot, amongst many other nations, and we're proud to celebrate that heritage, celebrate that foundation, and build upon it as we go forward. So today we're here to talk about debunking the myths. And so Adrian, I thought, let's start off with just doing a little bit of a fire round here on, I've got about 6 or 7 myths, and I'd like you to help us debunk them in really quick order, and then we'll get into a little bit more detail as we go. So the first, only the young are sexually active.
That's clearly not true. Older people are sexually active. They may be less frequently sexually active or differently sexually active, but that would clearly be a falsehood.
Only the young are sexually attractive.
Well, again, I think one can see that many people who grow old together find one another as attractive as they did when they were younger. Beauty is in the eye of the beholder. There are clearly some sexual stereotypes of older man, younger woman, fewer older women, younger men partnerships, but clearly older people are sexually attractive.
Sexuality isn't important for seniors.
Again, not true. People tend to, in a very ageist way, homogenize older people, and they are as different as you and I, both in culture, upbringing, attitude, and sex is important to many older people. It may actually be more important as they age. For many, it is admittedly less important, and that's often mitigated by the lack of an available partner.
And we'll get into that in more detail in a little bit, because I know that I want to cover that off properly. So the next myth is sexuality in later life is undignified, and they don't want sex anymore.
Again, not true. That in a very ageist way lumps all older people together, and it's not true. Clearly, our attitudes to sex and sexuality are often dictated by our upbringing. We have people from 60 to 90 alive who've got very different upbringings and very different expectations around sex and sexuality, how that's expressed. It might be dictated by culture, upbringing, religion, who knows? Again, let's not stereotype older people.
Next myth, men and women lose their ability to perform in later life. Even if they want to have sex, they can't.
Clearly they can. It may have to be expressed differently. And that might be because of ill health or other diseases, practical difficulties. There may be environmental, there may be in institutional environments where things are more difficult to achieve. Certainly, given the huge demographic change we've seen over the last 40 to 50 years, with a greater proportion of people living in single households, coronavirus and lockdown hasn't done much for people's dating game.
And we're going to go with a couple more, but I also want to tell people that if you want, we're going to unpack a lot of these later in the webinar. So please stay tuned and continue to watch if you want to get into more detail on some of these things. Next one, sex causes heart attacks in seniors, or they hurt themselves when they want to have sex.
Again, clearly, if you're dealing with other chronic diseases, you may need to do things differently. There is little evidence that anything other than extremely vigorous sexual activity might provoke a heart attack in someone with pre-existing heart disease, but so might playing squash or any other energetic function. Sex is often safer. In fact, it probably expends less energy with a regular partner than with maybe a newer partner.
Sexually active seniors don't have to worry about sexually transmitted diseases.
Unfortunately, not the case. And cruises are well known for their perhaps communicable nature of sexually transmitted infections. So yes, of course, although pregnancy isn't a concern in late life sex with an older partner, that has no difference in the chance of risking the transmission of a sexually transmitted infection. So protected sex with condoms or other barrier contraception is really important.
Desire for sex decreases with age. We covered that a little bit, but maybe there's a little bit more there if there is.
So again, very individual. The desire in some people indeed generally does decrease in association with aging, but that's incredibly variable. And what is normal for an individual may not be normal or usual for another.
If a widow or widower dates, it's only to find a new mate.
Well, I think there we're getting a bit confused with the idea of sex, the act of intercourse or whatever, and sexuality. And too often sexuality is equated with the ability to have sexual intercourse or the frequency. But sexuality is very different. It encompasses people's self-image, their interactions with others, and many levels of expression and affection. It's not just having it off. And it's really important to one's self-identity and well-being. So I don't think a widow or widower who's seeking a partner is really just in it for the sex. It fulfills social, emotional, and psychological components as much as anything else. And joy and romance and affection and passion and intimacy are as important to many, holding hands, physical touch, as having sex to some older people.
Sex is dangerous at a certain age.
I think that's true if you're on the edge of a cliff and your balance isn't very good, but largely no.
You might. And the last one was sexuality is only about sex. I think we covered that earlier, and we can tie that into the question earlier. Okay, perfect. So let's jump into it then a little bit more detail. How does a senior who has recently experienced a loss of a mate or a partner kind of mentally and emotionally approach dating again?
It's incredibly difficult. And again, people vary awfully from, I've had enough of that, it's not for me. But I think we've seen, as time has gone on, a very different, you might say more liberated view that a monogamous existence which is terminated by death of a partner should then not result in many years of abstinence. Clearly, the grieving process takes a variable amount of time and often on an individual basis. But regaining normal social and psychological functioning does or should encompass intimacy and sexuality. The length of time that takes, the resolve to get there does vary. And of course, now in this age of internet dating, there are sites which are dedicated to older people as much as younger people. And many relationships are precipitated by internet dating and are very successful. As much as group activities, social clubs, other places where people meet and spark off relationships.
Let's dive a little bit into the concept of intimacy. How would you say, what is the definition of intimacy, and how does its importance change as you age?
Again, there's no easy answer. It's awfully variable and often an individual expression of what counts for intimacy. There's good information about how important is sex in later life. We talked about people maybe having less desire associated with aging, but all of people with partners rate sex and sexuality as some importance, and emotional intimacy in relationships as a whole is extremely important. Clearly there are various barriers, which I'm sure we'll talk about, but there is considerable importance of non-sexual touching and physical intimacy in the expression of sexuality.
How does sex change with aging, and what can you do about it?
So there are some physiological changes. Clearly for women, the menopause is a major, if you like, change. And there are perhaps more gradual changes in men, and these are largely physical, associated with a slight waning of sexual desire. We say sexual desire and sexual activity does tend to decrease slowly with advancing age. And of course, there are lots of barriers. We talked about some of those cultural, religious, and ethnic attitudes to sex, which may well be barriers if you don't conform to that expectation. There are societal expectations that women, as we've said, in later life aren't sexually active, and if they are, then they're somehow nymphomaniacs when they're younger. This idea of the dirty old man, which we need to get over. There are physical barriers, and if you talk about those which occur in with natural aging, we talked about the menopause in women, which tends to affect the urogenital tract. So the vaginal skin becomes a little bit more fragile and thinner, might be a bit drier. The fat pad on the pelvis becomes a little less obvious and might make sex uncomfortable for some. So you can get over that. The use of things like vaginal lubricants, over the counter, or topical hormone creams, which are available by prescription, which are extremely effective. For men, largely, it's around erectile dysfunction. Testosterone wanes slowly in association with increasing age. There is no evidence that testosterone replacement for normal physiological lowering testosterone has any benefit, but for those people with very low levels for other reasons, that does help. But for men, often it's around the ability to have an erection of sufficient hardness and duration to allow intercourse. And clearly there are many therapies for that. Everybody's heard about Viagra. We couldn't talk about erectile dysfunction before Viagra. It simply wasn't done. There are alternative oral tablets available, which you can discuss with your healthcare provider. Where there are psychological problems, of course, for both men and women, talking therapies work. For men, there are also injection therapy or implants, which are done surgically. One of the most dependable and useful things is a vacuum pump. So there are things you can do.
No one wants to talk about their parents having sex. Most people then definitely don't want to talk about their grandparents having sex. But when we think a little bit about some of these barriers which stop conversation, what are some tips that you have for individuals, particularly as you age, to break down some of these societal barriers that stop the conversation from occurring? And I know that ends up happening with your physician, with external help, et cetera, which we'll get into, but thoughts in general about how people can start to break down some of these societal barriers on why we shouldn't or should have conversations?
Yes, and all those attitudes that we might possess. Again, we talked about those, old habits, fear of discussing sexuality, this so-called old-fashioned attitude, and these cultural attitudes really inhibit people with concerns about their sexuality going to their healthcare provider and asking about it. And what's often forgotten is that a healthcare provider may well have exactly the same attitudes and myths related to aging that the people themselves do. Likewise, busy healthcare providers might be insensitive to the needs of older people, don't know how to manage sexual problems in late life, and then feel uncomfortable in managing. And in fact, they're seldom asked. So it's another one of those, you've got to ask to get some kind of recognition of the problem. And often, very few men are ever asked about erectile dysfunction. Many few women, and very few women, in fact, fewer than half of sexually active older men and women who have got a concern or problem are ever asked about it. So you've got to gird your loins and really ask about it. It's part of this good health literacy and empowerment in managing your own conditions improves your quality of life because you have power.
And it also comes into this aspect of like, if you don't ask your healthcare provider, if you don't ask the professionals around you, they're not going to ask you either, because it does have this like awkwardness to it. So
absolutely,
start with the people that are around you.
Yeah, it's an uncomfortable situation, and it's best therefore brushed under the carpet. So ask.
When we think a little bit about some of the barriers to kind of an active or a sexual kind of an active sexual life as you age, what are some of the most common barriers that people have?
In very late life, we talked about availability of a partner, but there are also changes in body image would be associated with aging, has an impact. Certainly people may have had other illnesses that affect that. For instance, mastectomy for breast cancer has a profound impact on women's sexuality and change in body image. But of course, people might be dealing with arthritis and chronic pain, and other diseases of the heart or respiratory system, or even cognitive impairment that make sex and sexuality very different. We talked about some of those age-related changes in terms of decline in libido, but it takes longer to get going, and it might take then longer to get going again. So there are various changes that do have an impact on ability to have sex, and needs a bit more thought and maybe planning. Heart disease, diabetes, depression, some cancers all have an impact.
When we think a little bit about if we go down the path of sexual dysfunction, what are some of the common medical conditions that are associated with sexual dysfunction that people should be aware of? Because they may think, oh, something's wrong, and maybe there is something wrong, and maybe they should actually go and get help. But yes, what are some of those common things?
So coexisting medical conditions that we know have an impact would be heart disease, diabetes, depression, breast and prostate cancer, HIV, dementia, and incontinence. All are associated with sexual dysfunction in both men and women. So, there's, if you're dealing with other significant comorbidities, there may be a lack of interest per se. In fact, older women with heart disease said that they actually, apart from the problems of arousal and general discomfort, they also couldn't relax. There's this almost anticipatory, I'm not a well person, I really can't relax into this type of attitude problem. And likewise in men, heart disease affects sexual function and erectile function, as does diabetes.
So for some of these things, Adrian, is it possible to get help so you could relax, that you can be better? Absolutely it is, yes. And again, it requires a healthy inquiring and some advocacy on the part of the individual. Think a little bit about healthy aging.
And and also don't forget that the treatments for those conditions can also have an adverse effect on sex and sexuality, particularly say antidepressants, awfully common prescribed agents who which can cause sexual dysfunction. It's trying to find the one that doesn't make the sexual dysfunction worse and treats the depression that's important.
Fair. And maybe that gets me into the topic of healthy aging. How should healthy aging encompass healthy sexuality?
Healthy sexuality is part of healthy aging, isn't it? And I know we'll feel like you're just banging on about the same damn thing every time, but what's good for your cardiovascular health, your cerebrovascular health, so heart and brain, is good for your for sexual function and sexuality. Got exactly the same things: the Mediterranean diet, good sleep hygiene, moderate alcohol intake, not smoking, stress management, physical exercise are all essential to sexual health. So exactly the same thing again and again.
Have attitudes to sex and sexuality changed over the years?
I think there's an obvious answer, and that would be yes, certainly. People listening in will see the probably some be thinking everything's going to hell in a handcart, but we've seen major legislative and societal changes in sexual liberation, in tolerance, same-sex marriage, same-sex relationships, all sorts of stuff that has really signaled a change in society to sex and sexuality. Certainly people who were in cohorts before the war may be much more conservative in their views and practices related to sexuality and be less likely to talk to healthcare providers if there is a problem. Younger cohorts more likely to talk, because as much as later cohorts have different demands and expectations of later life, that encompasses expectations around late life sexuality.
Late life sexuality. Give me an example of like the oldest person or the person that the average society would have thought, oh, this person is never going to be sexually active, who was or has been.
Well, the level of evidence here would be really low, but we have people in their 10th decade in our clinics who are sexually active with their partner. Wouldn't always be penile vaginal intercourse. May well be other expressions of sexuality, including non-sexual touching. That's fine.
Let's talk about that for a second. Sexual touching, intimacy, how would you define those? What are the differences between them?
Well, again, people equate sex with intercourse. That isn't always the case. There's lots of practices which people would equate with being sexual activity. So, oral sex, masturbation, all of that. And there's good evidence to show that a good proportion of people of 60 years and beyond are active in all of those areas.
Yeah, and it's not what people necessarily think, but why not? And,
well, yes, there's the what's normal and acceptable for consenting adults is okay.
Yeah. Do you have some tips on how to talk about sexuality?
I think again, you need to probably rehearse the questions you want to ask in very plain language, not take no for an answer, and inquire and press the case. Because again, as we said, many healthcare providers will be as nervous and want to avoid these kinds of questions as you might have been yourselves. So there's no alternative but to come out with it, in my mind. And again, you've got this idea, haven't you, of aging gracefully. And I would say to everybody out there, no, don't age gracefully. Age as you want to age. We've talked in previous webinars earlier about living our best lives, and we shouldn't feel constrained by social desirability as much as perhaps we might have been constrained years ago.
Let's talk about social expectations. How do you find that social expectations end up maybe prohibitively dictating how someone views their sex life as they age?
It's difficult for me to generalize, but the expectation that you would come of a certain age, get married, remain monogamous for X number of years until your partner dies, and then be celibate, was a commonly held attitude. Now we know, as we said, we've seen profound demographic change. I think the number of people in the sixth decade being divorced in Canada or separated between 1980 and now has quadrupled. And the number of people living alone likewise has increased rapidly. That means there are a lot of people who are presumably in need of healthy sexuality, who are searching for partners. You shouldn't expect to be celibate just because you're on your own. That huge demographic change has had a lot of negative consequences for healthy aging. We've talked about the impact of social isolation and loneliness before. Abnormal sexuality is perhaps part of loneliness.
Well, and I mean, there are people who come into our communities and who meet partners,
yes,
and who do have a new relationship, and that might just be intimacy, that might be more, that might be less. But I think that there's never the lack of potential to have intimacy in relationships, and there's never a lack of desire, as it seems,
yes.
as people age.
Yep, I think that certainly for providers, particularly those in nursing homes rather than residential accommodation, that brings with it certain very thorny ethical issues, particularly where issues of consent and capacity rear their heads. And often there's almost the institutional mores outweighing the needs of the individual and that real person-centered care. And where capacity and consent is a concern, are often surrogate decision makers coming into the picture, and that gets really messy.
Yeah, and I think it's not a topic with a black and white answer, but what it is a topic that requires thought and the right values applied to it to say, okay, how are we going to do the right thing? How are we going to respect people? How are we going to preserve their dignity? But how are we also going to work with the people they want to work with? Like, work together with them to give them their best life. That's an important thing for us.
You're absolutely right. How can you optimize quality of life and minimize harm with a fairly wide kind of lens on harms? Absolutely.
Yeah, I liked your optimize quality of life. I think it's very appropriate for the audience of Optima. In that regard, I'm just thinking through, when we think a little bit about these myths and areas on sex and intimacy, are there any other things that we've missed? Things that you think are important for the audience to hear that we haven't talked about yet?
I think for those people who are interested and internet literate, there are a wide range of resources out there, not only those dating websites, but there are things like the Center for Sexuality has a whole website on sexuality and aging, talks about women's and men's sexual health, will give guidance, will talk about potential symptoms and problems and how you might seek advice and how to broach the subject. So there is a wealth of information out there, and perhaps seeking information, not being embarrassed to talk to one's families about those things is the way to go.
Yeah, and we'll make sure that as part of this this webinar, and at the bottom we'll publish some of the links that I know that you've shared with us around different sources of information and different areas that you can go for help and for information. And that ultimately this webinar, just as all of our other ones, are about how do we help you live your best life? How do we make sure that people are informed with the knowledge they need to be able to live the best life that they should be and hopefully will be living. And in today it has been around saying, how do we debunk some of those myths around sex and intimacy? There are other webinars on our YouTube channel, again, youtube.com/Optima Living, that cover everything from aging fearlessly in the era of COVID to being agile, not fragile, to obviously sex and seniors part 1, and many, many more. There's probably over 100 different pieces of knowledge and areas there answering relevant questions that people have around aging and what you can do to live your best life. So on that, actually, one more question I remembered for Adrian before we go. How does COVID, and particularly getting a COVID vaccine, affect your sexuality?
Not at all.
Good. I'm glad that was clear. Because obviously there are some that
well,
have
it should affect your sexuality in that you need to get your vaccination.
Yes, and then if you're ever going to have sex with someone, please ask them for the vaccine card first. With that, Adrian, thanks so much for taking the time. Always a pleasure, and we'll see you soon.
Thank you.